The National Electrical Code, often referred to as the NEC, addresses the use of protective coverings for fluorescent fixtures, particularly in sensitive environments like patient care areas. However, the NEC does not universally mandate the use of protective coverings for all fluorescent fixtures in such areas. Specific conditions must be met for fixtures to be compliant without these coverings. The NEC Section 517.14 Current is relevant here. It stipulates that protective coverings are not required if the fluorescent tubes are type A or B, which are low-pressure mercury vapor lamps, and if the fixtures are not exposed to moisture or flammable materials. This means that if a hospital or healthcare facility uses fluorescent fixtures with type A or B lamps in locations where the fixtures are protected from moisture and flammable substances, they are technically compliant with the NEC without needing additional protective covers. However, compliance with the NEC is only one aspect of ensuring safety and optimal performance. Manufacturers of fluorescent fixtures often provide their own recommendations regarding the use of protective covers, especially when parabolic lenses are involved. Parabolic lenses, sometimes referred to as egg crate lenses, are designed to reduce glare and improve light distribution. Some manufacturers suggest that using protective covers in conjunction with these lenses can further enhance these benefits. Firstly, protective covers can help to minimize glare and ensure more even distribution of light, which is particularly important in patient care areas where visual comfort is crucial. Secondly, these covers offer an additional layer of protection for the bulbs themselves. They can prevent damage from accidental impacts or contact and shield the bulbs from dust, dirt, and other contaminants that can accumulate over time and reduce their efficiency and lifespan. The electricians often make decisions about protective covers. While the NEC and manufacturer recommendations provide valuable guidance, it is ultimately up to the installing electrician or the facility management to determine whether additional safety measures are necessary. Even if the NEC does not explicitly require protective covers, an electrician might choose to install them as a precautionary measure, especially in areas with high traffic or a greater risk of accidental contact with the fixtures. This decision could be based on a variety of factors, including the specific layout of the space, the types of activities that take place there, and the overall safety culture of the organization. When observing fluorescent fixtures in a hospital setting, the absence of protective covers does not necessarily indicate a code violation or a lack of safety awareness. There could be several valid reasons why these covers are not present. One possibility is that the fixtures meet the NEC requirements for low-risk patient care areas, as described earlier. Another is that the hospital has a specific policy that does not require protective covers in certain areas or under certain conditions. Additionally, the hospital staff may have assessed the environment and determined that the fixtures are not exposed to moisture or flammable materials, thus negating the need for additional protection. Despite the potential for compliance without protective covers, it is generally considered a good practice to install them in patient care areas. This is especially true in high traffic zones or locations where the fixtures are more likely to be exposed to moisture or flammable substances. The benefits of protective covers extend beyond mere compliance with regulations. They contribute to a safer and more comfortable environment for patients, visitors, and staff. They can also help to prolong the lifespan of the bulbs and reduce maintenance costs over time. When considering whether to install protective covers, it is important to weigh the potential benefits against the associated costs. While the initial investment in covers may seem like an added expense, the long-term advantages in terms of safety, performance, and maintenance can often outweigh the upfront cost. It is also essential to select the right type of protective cover for the specific fixture and application. Covers are available in a variety of materials, styles, and sizes, so it is important to choose one that is compatible with the fixture and provides adequate protection without compromising light output or aesthetics. Protective covers are not exclusively mandated by the NEC for fluorescent fixtures in patient care areas, but several factors, including manufacturer recommendations, safety considerations, and best practices, often support their use. Making an informed decision about whether to install protective covers requires a thorough understanding of the relevant codes, standards, and guidelines, as well as a careful assessment of the specific environment and application. By taking a holistic approach to lighting safety and performance, healthcare facilities can ensure a safe, comfortable, and efficient environment for everyone. Furthermore, consider the specific types of fluorescent lamps being used. Type A and B lamps, as mentioned in the NEC, are low-pressure mercury vapor lamps, which are commonly used in general lighting applications. However, other types of fluorescent lamps exist, and their characteristics may influence the need for protective covers. For example, some lamps may be more fragile or sensitive to environmental conditions, making them more susceptible to damage or failure without adequate protection. Another factor to consider is the mounting height of the fixtures. Fixtures that are mounted to low height are more likely to be within reach of people and objects, increasing the risk of accidental contact and potential damage. In such cases, protective covers can provide an extra layer of safety and prevent costly repairs or replacements. The design of the fixture itself can also play a role in determining the need for protective covers. Some fixtures are designed with built-in features that provide a degree of protection to the lamps, such as recessed lenses or protective housings. However, even with these features, additional covers may still be warranted in certain environments. The frequency of maintenance and cleaning is another important consideration. Fixtures that are located in areas that are difficult to access or that require frequent cleaning may benefit from protective covers, as these covers can help to prevent dust, dirt, and other contaminants from accumulating on the lamps and reducing their efficiency. When selecting protective covers, it is important to choose a material that is durable, easy to clean, and resistant to chemicals or other substances that may be present in the environment. Polycarbonate and acrylic are two common materials used for protective covers, as they offer a good balance of strength, clarity, and chemical resistance. Additionally, the cover should be properly installed to ensure a secure and effective fit. Loose or improperly installed covers can be a safety hazard and may not provide adequate protection. Regular inspections and maintenance of the covers are also necessary to ensure that they remain in good condition and continue to provide the intended level of protection. In addition to the physical protection they provide, protective covers can also offer aesthetic benefits. They can help to create a more uniform and visually appealing appearance, especially in areas where multiple fixtures are installed. Covers are available in a variety of colors and finishes, allowing you to customize the look of your lighting system to match the surrounding decor. Finally, it is important to stay informed about the latest codes, standards, and guidelines related to lighting safety and performance. The NEC is updated every 3 years, and other organizations, such as the Illuminating Engineering Society, also publish recommendations and best practices for lighting design and installation. By staying up to date on these developments, you can ensure that your lighting systems are safe, efficient, and compliant with all applicable regulations. In summary, while the NEC does not always mandate protective covers for fluorescent fixtures in patient care areas, there are many reasons why you might choose to install them. By considering the factors outlined above and making informed decisions based on your specific needs and circumstances, you can create a safer, more comfortable, and more efficient lighting environment for everyone. Firstly, always prioritize safety by evaluating the potential risks of exposed bulbs, especially in areas with high traffic or potential for accidental contact. Secondly, consult manufacturer guidelines for the specific fixtures being used, as they may recommend protective covers for optimal performance and longevity. Thirdly, consider the environment and potential for exposure to moisture, flammable materials, or other contaminants that could damage the bulbs or create a safety hazard. Fourthly, weigh the benefits of protective covers such as reduced glare, improved light distribution, and increased bulb lifespan against the associated costs. Fifthly, choose the right type of protective cover for the specific fixture and application, considering factors such as material, size, and ease of installation and maintenance. Sixthly, ensure that the covers are properly installed and maintained to provide a secure and effective fit. Seventhly, stay informed about the latest codes, standards, and guidelines related to lighting safety and performance. Eighthly, consider the aesthetic benefits of protective covers and choose a style that complements the surrounding decor. Ninthly, remember that the decision to install protective covers is ultimately a judgment call based on a variety of factors, and it is important to carefully consider all relevant information before making a decision. 10thly, document the decision-making process and any relevant factors that influence the decision, as this can be helpful for future reference and compliance purposes.